Everyone, so I wanted to do a quick video on the role of the feet in everyday life and how your foot posture can have a great impact on your quality of life, on your movement, and also on your health. And one of the greatest misconceptions, in my opinion, in the fitness industry is that rarely do we look at someone's foot posture. I think that this is a fundamental mistake in the sense that foot posture could give us a lot of indication in regards to what might be happening upstream. When we look at someone's feet, and this is a platform that I have in my clinic, which allows me to see the weight-bearing surfaces of an individual, 70 to 80 times out of 100, what I'll see is that one foot seems to have proper weight-bearing surfaces. The toes have full contact with the ground. There is a nice lateral band that is shaped on the lateral side of the foot, and there's proper weight-bearing surfaces on the heel. All of these components actually have a direct impact on the way that your brain processes information coming in from your feet. Now, if we look at the other foot, you'll notice that the weight distribution is not the same. And this is really important because the brain actually uses the information that's coming from your feet in order to stabilize your body before you start to move. And we tend to assess movement. Many professionals are looking at movement and gait patterns and our heel strike and the way that we are coordinating our movement. It is true that gait can give us a lot of indication in regards to what's actually happening in our brain. But before we start to move, we have to be stable. And that stability comes from the brain, and the brain uses information from not only our feet, but from our eyes and our inner ear in order to stabilize every single joint in our body before we start to move. Now, the position of the temporal mandibular joint, which is your jaw, is also involved in this equation. We're not going to get too much into that in this talk, but this is basically a simple representation to give you an idea of how all of those different sensory entries can potentially contribute to your posture and affect, of course, your movement. So to have a better understanding of how your foot posture can create an imbalance, let's start by talking about those little sensory receptors that are located in your skin. So if you were to take a piece of skin and zoom it out and look into it with a microscope, you'd see that there are mechanoreceptors, which are basically little antennas that send information to your nervous system. They connect to your spinal cord and go all the way up to a part of your brain called the sensory cortex, which is located here. This is a side view of the brain. And the sensory cortex is the part of the brain that receives sensory information. So if you're actually stepping on sand or on gravel, the information that comes in from the skin of your foot makes it to that area of your brain. And then the sensory cortex will then project onto your motor cortex, which is the part of the brain that allows you to move your muscular system. Now, you'll notice that these sensory receptors, those mechanoreceptors, have very precise functions. Some of them will relay information in regards to stretch. So is your skin being stretched? Is it being pulled on? Are you wearing different types of shoes that are modifying the shape of your foot? Are you walking on sand? Are you walking on ice? Or are you about to slip and hurt yourself? So all of those mechanoreceptors need to send really, really fast and really, really precise information to your nervous system so that you can be in a state of protection at all times. The problem in the 21st century is that we tend to wear shoes that will deform our feet. And although I understand that wearing shoes is something that is essential in our daily life, but we tend to choose shoes that are more fashionable rather than pick the ones that are made to accommodate a human foot. Now, children should be barefoot for as long as possible to give them a chance to form their arches, which is the foundation that will bear their entire body weight. And this is when children are in their peak window of brain and nervous system development, and putting thick shoes and inflexible shoes on their feet will actually tame down all of that sensory information that is actually essential for brain growth. So this is when you'll start seeing conditions with feet, whether it be a flat foot, a Morton's toe, plantar fasciitis, but you may also have knee pain, hip pain, and back pain. So how does the foot affect the kinetic chain? Well, because most of the population has a mixed foot, which is a mixture of a pronated foot and a supinated foot, a pronated foot will have an immediate impact on the knee because it creates an internal rotation of the lower leg, which is the tibia, which brings the knee in, and then an internal rotation of the femur, which is your leg, that causes the hip to move in a certain way. So in the case of a pronated foot, which is a foot that collapses on the floor, we'll see the pelvis move down. And the opposite will be true for the other foot. And what that translates to from a postural perspective is we may see in the frontal plane someone who has a lower shoulder, a lower hip, a rotated shoulder, or even a rotated hip. Now, because the weight-bearing surfaces of our feet have the influence to affect the movement of our hips, it's also going to have a direct impact on our sagittal plane. And our sagittal plane represents the capacity that we have not only to activate our posterior chain, but also to fight gravity efficiently with wasting the least amount of energy. So because of this reality, a pronated foot will create an excessive curve of the lower back and an excessive curve of the upper back. So the minute that the lateral band of the foot stops having contact with the ground, it's going to start changing the curves of your spinal cord, creating somewhat of an anterior pelvic tilt. The full expression of this reality is when the midfoot collapses. When the midfoot collapses, funny things start to happen. You start getting the projection of your umbilicus and the rounded shoulders and the forward head posture that starts to take place. And this is referred to as a sway back posture. The flat back is associated to feet that are supinated in nature. And we'll notice that the weight-bearing surfaces on this foot is asymmetrical. And that's really, that's an interesting component as well, because most of the time, these foot imbalances are also asymmetrical in nature. So the supinated foot is going to be associated to the flat back. Now, when we're talking about a mixed foot, which is a supinated foot mixed with either a flat foot or a pronated foot, so what that will cause, it will cause an anterior pelvic tilt, but also a forward displacement of the center of gravity. And that's actually going to be extremely painful and detrimental for the aging of your spinal cord. That spoke about chiropractic care and the effects of an aligned spine on the prefrontal cortex. The prefrontal cortex is that part of the brain that children form fully or is not fully formed up until the age of 8 years old. And it's a really, really important part of the brain because not only does it receive input from different regions of the brain, but it's responsible for executive functions, cognitive processes that involve controlling short-sighted behavior. It helps us act with a goal in mind. It's part of the brain that helps us stay motivated, help us stay happy and productive. So what we're finding now is that we can have an effect on the spine through the feet. And what you're looking at here is an image of an 8-year-old girl 3 weeks apart, where we worked solely on foot proprioception to see if we can have an impact on her sagittal plane. So this was in the context of 2 consultations, and this is in a 3 weeks span. So how can you tell if you have a foot imbalance? But most importantly, what can you do about it to fix it? Well, the first thing that needs to be mentioned is that the foot has 3 pathways in which it can affect your posture. It can create an imbalance through the skin, it could create an imbalance through the muscles, but it can also create an imbalance through the actual position of your bones. So all three of those sensory entries, all three of those proprioceptive entries can have an impact on the way that you walk, but also on the way that you stand. So the first step would be to identify whether or not you have a foot imbalance. And you can do this either by stepping on a cardboard with wet feet and looking at your footprint. You can also do what I really like to do in my office is a one-legged stance, which will give you a real feeling as to what your foot is doing when you lift one foot off of the ground. By the way, this study confirms that the inability to stand on one leg for 10 seconds is associated with an increased risk of mortality in middle-aged and older adults. This suggests that the 10-second one-legged stance test could be a valuable tool in predicting survival outcomes in older populations. But you can also look at the wear and tear of your shoes, whether in the forefoot or the rear foot. Anything that is asymmetrical is bound to create excessive stress on the body, excessive stress on all of your joints, and is certainly bound to affect your posture. So this was our basic introduction to our foot mechanics and gait cycle online webinar. I hope that you guys enjoyed it. If you're ready to dive deeper and take your understanding of foot mechanics and the gait cycle to the next level, sign up for the full course today and start transforming your practice.